From the first appointment onwards, everything was just so comfortable. The facility here is brilliant. The surgery went great. It was a success. There was no complications. Everything was great. The service, the food, my room was very comfortable. Hi, my name is Nizar. I'm 33 years old and I've been living in Dubai for the past 12 years. And I'm here now to tell you the story of my accident that happened last year and my journey with King's College. I was going back home around 2 or 3 in the morning, around 500 meters from my building. My eyes just shut down. For a split second. My tire hit the pavement, the side pavement of the road. The car flipped over. The next thing I remember is crawling out from the car. And a few minutes later, a car stopped behind me. And there was 3 guys in the car that helped me get out. I was losing a lot of blood from my hand. I had a degloving of the hand. Luckily, I had no broken bones anywhere in my body. So my only injury was my hand, thankfully. I was transported to the nearest hospital. After the doctor diagnosed my case, we started inquiring about the best surgeons, hand surgeons in the UAE. King's College Hospital and Dr. Yasser Khattab's name came up. And we took feedback from people who already been here before. And we decided to come here and to pursue this journey with King's College. Dr. Yasser received me and my mother at the time who flew in. Dr. Yasser was taking a look at my hand and to see what exactly needs to be done. He offered me a few solutions for my case and he let me decide. From the first appointment onwards, everything was just so comfortable.
My name is Dr. Yasser Khattab, consultant plastic reconstructive and hand surgeon. I would like today to talk about a very interesting case about Mr. Nizar, who's a patient of mine. He's 32 years old gentleman who was subjected to a car accident nearly 11 months now. He got a very bad injury at the dorsum of his left hand, including a degloving or a soft tissue loss. He was transferred to our hospital 2 to 3 days after the accident. When I saw him for the first time, his hand was in a very bad shape. There was some infection, soft tissue loss of his hand, including his wrist. His wrist joint was open, and he has a loss of the extensor tendons, the tendons which move the fingers up, including his thumb, index, and middle fingers. Also, there was no coverage at all. He lost major part of the skin at the dorsum of his hand, including the muscles between his bone. I discussed in details about the extent of the injury. He understands the boundaries of the surgery and the challenges he's facing, and he was actually very good patient, and he was compliant along the course of the treatment. Next day, I took him under general anesthesia, where debridement or cleaning of his wounds achieved, and I put a temporary dressing for him, which is called a VAC dressing, or the abbreviation of vacuum assisted closure, to clean his wound. After a few days, I took him again to the theater, where a first stage groin flap was done. The groin flap is simply we are taking a soft tissue, including the skin and the fat from the patient's groin, and attach it to the area of the donor side. Not only this, I took palmaris longus, which is an extra tendon in the volar aspect of his forearm, and I used it for extensor tendon graft. I used it on 4 tendon grafts, including 2 for his thumb for proper extension, 1 for his index, and 1 for his middle finger. The whole surgery took around 4 hours, and he was transferred in a stable condition. After 1 week, I did a dressing change, and the flap was viable. He was stable. He was comfortable, pain-free. Then after 2 weeks from the first surgery, I took him again for the final stage, which is the second stage reconstruction, including division of this pedicle flap. And in sitting means that stitches to the donor side or his hand where the defect was there, and closure of the donor side, which healed very nicely. He did very well. I saw him after 1 week, and he was discharged from the hospital in a stable condition on oral antibiotics, painkillers. I was seeing him in a close monitoring every week. He did very well. I removed all his stitches after 2 weeks from the second procedure.
After my second surgery, because I had to do 2 surgeries, the second one was to remove my hand from the stitching that happened. A month after that, I started doing physiotherapy sessions with Dr. Samira Cutts. Dr. Samira is very knowledgeable in her field. She helped me understand my case and understand what's going on with my hand, was very detailed. I couldn't move my hand in the beginning. I couldn't move my fingers. Throughout, month after month, I started moving my fingers more. I can bend my fingers more. Seeing improvement every month after month was great. Was something that kept me going. I'm still doing sessions now. I still have probably around eight months to another year of sessions. A big thanks to everyone here at the hospital, Dr. Yasser first, for doing this surgery so impeccably. Dr. Samira, who's been with me for the past year, my physiotherapist and my psychologist as well. Thanks obviously to all the friends and family who supported me on this journey and still supporting me. And for everyone who has or had accidents and they're going through the same recovery journey, stay patient, persistent, focus on the objective, and you'll get there eventually.
My name is Samira. I'm an occupational therapist. I work here at King's College Hospital, London, and I'm based in the orthopaedics department. I work with people with a range of different musculoskeletal injuries and conditions. Nizar first came to see me a month after he had his multiple surgeries. That would have been the beginning of March 2022. The biggest challenge for me from a therapeutic point of view is that there was a lot of scarring. The first point of call from a first phase rehab perspective was really wound management, making sure that the wounds heal correctly and it's infection free, and we try to minimize the scar tissue damage impacting on tendon function as much as possible. The case was very challenging because typically when I treat people for hand injuries, it will be one or two fingers, perhaps the wrist, but in Nizar's case, it really was the entire hand and the wrist. He had a graft placed on the skin for his thumb. So I had to work to manage and maintain function in all of the digits of his fingers and the entire dorsum of the hand and the wrist. So that's a considerable amount of therapy than your average person. So the therapy provided comes under the umbrella term of hand rehabilitation, and within each phase of rehab determines the type of treatment provided. So as mentioned earlier, the first phase really focused more on wound healing whilst trying to maintain good healing of the tendons at the same time. We did a lot of splinting. We also did a lot of manual therapy and soft tissue work and a lot of exercise rehab as well. So it's really very much a combination of all of those different treatment modalities. Nizar's doing absolutely wonderful now. He is able to engage in all of the activities of daily living again, and he's pain-free. So the main aspects, that the end stage of rehab which we are at now, is really focusing on being able to do some of those tricky tasks. For example, martial arts, as I mentioned, that's really his main goal now, and being able to fully powerlift competitively and have full hand grip strength in his hand again. So far, I have been treating Nizar for 1 year. It's come to his anniversary. We are very much at end stage, and we just have a few more months to go now to allow Nizar to fully engage in all of his activities of daily living.
In King's College Hospital, we have a dedicated department for hand surgery and very dedicated physiotherapy team, and also we have an occupational therapist which can modify splints and keeping the patient a healthy functional position of the hand. Ms Samira Cutts, which is a specialist physiotherapist and she's a pioneer in treating very difficult hand cases, and she did a very nice job with him, extending for over the last 10 months. He did very well, and actually I have to mention that the compliance of the patient, Mr. Nizar, and his trust to the hospital and in the treating surgeon and in the treating physiotherapist helped us to achieve nearly normal function after 11 months from the surgery. As you can see that he started to practice his daily activities shortly after the surgery, but the main part about his hobbies, weight lifting and kickboxing, he was able to start this 6 months after the surgery. Nowadays, around 11 months post-surgery, he can go back to his hobbies. Not essentially the same amount he was lifting before the surgery, but he's in the right direction. After another 6 months, he will be able to be exactly the same like before.